We're back on Born B-464 with Dr. James Butler, and we're on location in his offices. Now, Dr. Butler, we've identified the problem. What are we going to do next?
Well, we're going to take a digital x-ray, okay?
Really? It's not
yeah,
gonna...
and then we'll show you some magic after that, all right?
Okay, it's not going to hurt or anything, is it?
No, ma'am.
No. What's this for?
Digital x-rays are very comfortable. Well, it's interesting. Digital x-rays really do not require these, but people get nervous if you don't use them.
Really?
So we got one. And it's funny but true. You know how life is.
Right. Now, so, this is something new. What is this?
Well, this is an XCP instrument, very common. And what it'll do is it'll let this be gently in there, and you can hold it without effort, okay?
Okay.
So you're just going to open for me.
Uh-huh.
And we're going to get this thing in here just like that. Okay, and you're going to gently bite. Good, and don't kill it. There you go. Now watch this. Swing this thing around. And we've got our cameraman at a safe distance, and I'm going to go to a safe distance, and we're going to get a shot. Okay, 1, 2, 3, go. Fantastic. Okay. Now on our computer screen, we have that. Thank you very much.
Okay.
Now we've got this beautiful x-ray of your tooth. How about that, huh?
Really?
Yep.
That's how fast it was? Because I remember...
It's less than 4 seconds. I'll click it up here on a full screen. And there we go.
That was easy.
4 seconds. Painless and easy, right?
Yeah, because usually...
And isn't that sensor nice and soft? So
oh,
it didn't
yeah.
irritate you?
That actually was the easiest I've ever taken a dental x-ray before.
Yep. And now we're going to adjourn and let's go look at the x-ray.
Let's look at the x-ray and see what's going on.
You betcha.
Dr. Butler, we're in the consultation room. We already did the x-ray. Now what?
Well, now we're going to find out what we can do for you, okay?
Okay.
So we've already examined the mouth. Everything's healthy with the exception of the broken bridge.
Right.
And obviously, we don't want to go with the same thing. It won't last long enough, and it'll end up...
And I'm going to be living to 150, so,
That's exactly
whatever.
Right.
Okay,
it's so
right.
true, you know?
It is true. People are living longer.
But we want to do a system that's stronger and more natural, because if you strengthen the mouth, it can last. If we don't strengthen the mouth in the back, you'll actually wear out your front teeth, too. And
really?
That's how nice people who have made a big effort end up in dentures and stuff, is because we don't strengthen the mouth early enough. Okay, so when we start seeing these warning signs of the domino effect of back to front wearing out your teeth, then we need to act quickly. Okay, so what we're going to do is we're going to pull up your x-ray. Okay.
Okay.
And I'm going to select your film that shows the area. Okay.
Yeah, and show me which where we're talking about.
Okay. Now this is that lower left that we had the photographs of.
Okay.
The porcelain's broken here and here. Okay.
Right.
This is the substructure of that. These are your natural teeth, okay?
Okay, but there's not a natural tooth here?
That's correct. And at the time this was done, this is a common procedure that a lot of people have. This is called a bridge, a fixed bridge, all right?
Which means?
It's porcelain fused to metal fixed bridge, meaning that there are anchor teeth and then there's false teeth that are connected to them, all right? So this is your false tooth called the ponic. All right? Now it feels very good and very natural, but over the long haul, it wears out before we do.
Really?
So this is an epidemic proportion. Now there's other kinds of bridges that would be like there would be a tooth here, and the teeth would be in the middle. But many, many people know what I'm talking about because they've got these. All right? Mm-hmm. Problem is they don't last long enough, and we're wearing them out. So what do we do about it? Well, we're going to strengthen this area. What we want to do is keep these two teeth healthy by not straining them anymore.
Okay.
And keep it from breaking by making the teeth back here that take the strain of the bite more natural.
Okay.
Okay, so what we're going to do is we're going to select an implant that will fit in this area.
Okay.
And we'll take this tooth off. We'll place an implant and a natural implant tooth there. And then you'll double the strength of that left side of your mouth will be doubled.
Doubled.
Yes.
Wow.
You watch this, okay?
I want to watch this.
All right. So we're going to calibrate the film real quick to make sure there's no distortion. I'm going to make a test measurement, okay?
Okay.
And that looks okay, all right?
All right.
So there wasn't any distortion in the film because we had an excellent x-ray tech doing this film.
Really? Was that Dr. Butler?
I'll bet you haven't taken an x-ray in 10 years, but the staff is so efficient at that. They're fabulous, right?
But in emergency situations, this is important.
Well, now I'm going to select the type of implant that would be likely to fit, okay?
Okay.
So we're going to use an implant called a Camlog.
A
It's
Camlog.
one of the best implants in the world.
Yeah.
Okay, and we're going to use a 5 millimeter because it's a molar, and probably 11 millimeters long. Okay, so here's the implant, and I'll click on the screen, and voila!
There it is.
It's magic.
Okay. Right now, what happens?
So now we're going to rotate it, and we're going to put it where it belongs.
Right.
Okay, right about there. Okay.
Okay.
Parallel to adjacent teeth. All right.
So those are the teeth. So it's like a tooth that the implant's
It's a tooth root.
Tooth root.
It's a tooth root.
How far do you go down with this thing?
You put it where the natural teeth used to be.
Okay.
Okay. Now there's an implantologist secret that the general public doesn't know about.
Okay, tell me what that is.
Well, here's what it is. Teeth have nerves inside them.
Right.
When a tooth is removed, the nerve comes with it.
See, and that's what I told you. I didn't feel that tooth. Is that
Right.
why?
That's why. So
Okay.
here's the thing. If we go back where you used to have a tooth, all right, you can place this implant with no sensation afterwards.
Really?
Yeah, it feels like a natural area
Okay.
because there's no nerves left in this bone. All right. Now we got to keep your gum happy, but that's pretty easy.
Really? How do you do that?
So, well, we, numb it, sedation, whatever it takes to make you comfortable.
That would be sedation and the other thing,
That's
right?
exactly right. Numbing and sedation.
Right.
That's the most common way.
Right.
But people are surprised of all the things that they've ever had, root canals, bridges, crowns, big fillings, oral surgery. This seems to be the one that is the simplest. At the end of it, they always go, "Are you done?" And they can't believe it.
That's good because I'm one of those patients that had all of that.
That's true. Now, so what will happen is we'll put that in. Okay, now we're done. That looks like we picked the perfect one right off the bat. Okay.
Okay.
So that'll be your new tooth root. Now, it doesn't have to be as long as these. Another implantologist secret, these are twice as strong as these.
Really? Why?
So implants aren't getting bigger, they're getting smaller.
And stronger?
And stronger because it's a non-invasive type of procedure
Okay.
when we keep them small. Okay? Because
So you don't have to drill down or anything?
yeah, a lot of the complications come from trying to get too big an implant in a smaller space. But because they're super strong, these are titanium alloys, and they're stronger than pure surgical grade titanium.
Wow.
They've had alloys added to them, okay? So this is twice as strong as that, even though it's smaller.
Okay, got
Okay.
it. Now, Dr. Butler, you showed me where the implant, where it's going to fill into, where the bottom of the tooth is.
Right?
Okay, the implant. Where's the top part of the tooth, doctor?
Well, once we get this in and get it healed,
Right.
okay, sometimes the same day, sometimes a little bit later,
Okay.
we're going to go ahead and put a tooth on, okay? So see how this tooth is smaller than a natural molar?
Right.
This is the big change we're going to get.
We're going to
So
have a big change here.
Not only are we going to double the strength this side of your mouth, we're also going to give you a real molar to chew on, okay?
Oh, wow.
So here's what our molar is going to look like.
Okay.
all right? Okay, so what we're going to do
Yeah.
is we're going to put what's called an abutment on this thing.
Abutment?
Abutment, which is a term used for something that supports something else, right?
Okay.
Okay, now screw down in there, okay?
All right.
Some of our implants already have them on there.
They
Okay.
really do?
Yeah, so we just screw it in and we put the tooth on immediately, okay?
It doesn't hurt to screw it in.
No, because it's all inside this metal part, which
Okay.
is not even touching your body.
Oh,
okay?
great.
So then we're going to put an abutment on, and since we got this beautiful foundation, then we're going to make a regular cap that looks like a real molar,
Really?
just like this.
Oh, wow. Oh, my gosh, that's so much bigger. That's going to fill my mouth.
Isn't that fabulous?
Oh, yeah, I'll be able to chew differently,
And
too.
that's what we're going to look like.
Wow.
That's going to be great?
Yeah, 30 minutes, huh?
Yep. So we're going to double the chewing capacity of the left side of your mouth, double the strength, because one of these is two of these, and return you to nature's size and shape to help with your cheek and not let you go sagging in. And also, when you bite, you'll have a full bite on
I'll
this
be able
also.
to really
Yep.
actually easily chew things, and that's
Right.
really important to me.
90% of adult chewing is done between these two teeth.
Really.
Yes.
And
So you only have 1.5, and now you're going to have 2.
oh, wow. Because I've noticed that I have been favoring that since it broke off.
And we were talking about how this is going to help TMJ.
Oh, yeah.
By allowing you to load your molar right next to your muscle, okay, you won't have this abnormal force vector, the direction and strength of your bite will be corrected, and this is going to make it easier for us to control your TMJ symptoms.
Right. Because even with the mouth guard, I wake up in the mornings and it still kind of hurts.
Well, when you put pressure on this bridge, it's not normal pressure because the pressure is supposed to come from this zone of your mouth.
I see.
So it's not natural to have your pressure too far forward, and that's very damaging to almost everybody that has TMJ.
Right. So it'll make it a lot easier for me.
Yeah.
So when are we going to get this done, Doctor?
Well, as soon as we can get you on the schedule, young lady.
Okay.
We've also printed a version for you.
Okay, this is beautiful.
Yep, I'll show you that so we can print out your version.
Okay.
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 So we're going to load this
Right
here. And we'll select these images, and then we can print that. And then you'll know exactly what we're going to do for you. And you can take that home, and you can show it to Bill.
I can show it to Bill. Well, it's going to be a lot easier for me because I'll tell you what, this has been a real problem. I mean, this happened about 2 or 3 weeks ago, and I am so glad I came in because I'll tell you what, I was really worrying about what was going to happen, how long this was going to take, is it going to be painful, all the things that you normally think, especially if but since I've been coming to you as a dentist, I'm not afraid of dentists any longer. I feel very safe, very assured that I am going to be so much better. I'm going to want to smile more often, which I tend to do a lot anyhow. And then you're going to be able to then do the veneers on the back part of these other teeth, right? So that I could really do a big smile.
We're going to go ahead and replace that old bridge work so that we match the front tooth color, so that whole segment will look completely natural.
Completely natural.
Yeah, and it'll fill your face in.
Will it? I'll have a little bit bigger cheeks, maybe.
Well, it's this lower part that sags, not the cheeks. Between here and here is the muscle, and that starts to come in over time.
Okay.
We lose collagen as we age, and if you lose molars, it just doubles the problem.
Right.
So, and interestingly, this also ties into helping to control your TMJ symptoms. And when you come in, we're going to show you how the Botox injections will be able to get rid of your pain from your TMJ.
That'll be, because especially during certain times of year, because I have allergies as well, that's when it hurts even worse.
Yep.
So that'll probably help that. And usually with Botox, even they're using it for sinus pain and stuff today, right?
There are a lot of uses. My dad had bladder cancer, and they used it to control his frequency of urges.
Really?
Yes, ma'am. So Botox has been discovered to help a lot of things.
Wow.
Yeah, so we're excited for you. And you know what? These are some of the most common problems we see in the baby boomers.
Right.
And we see these problems every week. This is, one of the things about this is that so many people are really fearful, well, what happens when this fails?
Right.
And they don't know what we can do for them, and it turns out we can do a lot.
And I think that, you should start thinking about that. We need to take a short break, and we'll be right back on Born Before 64 with Dr. James Butler and Kathryn Raaker.